The first sign of breast cancer often is a breast lump or an abnormal mammogram. Only a physician can make that diagnosis, but early detection increases your chances of having a curable cancer. We learned from Doctor Jeannie Shen of Methodist Hospital in Arcadia the treatments currently used to fight breast cancer.
Breast cancer can come in many different forms. Certainly a lump is one way that breast cancer can present. Other signs of breast cancer can be subtle changes, perhaps in the shape of the breast. Some patients may notice some dimpling of the skin. On occasion, patients may complain of liquid coming out of their breast from the nipple. If we're lucky, however, patients will come in with no symptoms at all, and we catch them on a mammogram.
Dr. Shen discusses the standard currently being used to treat breast cancer.
Almost all stages of breast cancer, even including sometimes now the stage 4 breast cancers, but certainly all the earlier stages of breast cancer, surgery remains the mainstay of treatment. However, some patients may require more than surgery, some patients may need radiation or chemotherapy, and that just depends on their individual situation. As a surgeon, oftentimes I am the first person to see them after they've been diagnosed, after they've been given the news by their primary care physician or perhaps the radiologist who did the biopsy. I often tell patients I see myself not just as a surgeon and the captain of the ship for this journey for them, but really as an educator. Because I find that as patients become more educated, it takes away a lot of that fear and it gives them a sense of control. I think surgeons have driven technology and advancements. Surgeons have come to understand in terms of radiation therapy, we do the surgery. Those patients who have a lumpectomy often need radiation, but they complain of or they have difficulty coming in every day for 6 weeks. So surgeons sort of identify that perhaps finding a shorter course of radiation therapy that could be more conveniently delivered. So for instance, one of the newer technologies that's emerged in radiation therapy is instead of having a woman come in every day for 6 weeks after a lumpectomy, some patients can have their treatment completed in as short as 5 days with the help of a small catheter that's placed by the surgeon at the time of surgery.
Dr. Shen tells us the importance of imaging.
Our imaging has continued to advance, and in the last 10 years, the advent of digital mammography has made a big difference. Digital mammography has been shown to be more sensitive, particularly in women who have dense breast tissue, who are young and premenopausal. In those women, sometimes they may feel a lump that we can't see on mammogram. Digital mammography now allows us to catch cancers at an earlier stage in those women. So certainly I think advances in screening technology have improved. Also, we have identified some women who perhaps are at higher risk of breast cancer who would also benefit from a screening breast MRI. Another very sensitive tool that's developed and improved over the last 10 years, again allowing us to catch cancer at an earlier stage. Women who are diagnosed with stage 0, stage 1 cancer, their 5-year survival rates are 100% now. So we catch it early, we can cure them. Besides the improvements in screening, certainly I think advances in surgical technique, advances in not just radiation, but importantly systemic therapy, medications. Remember that ultimately women don't die from the cancer in the breast, they die when the cancer cells have spread. And so a lot of the improvements in survival, I think, in the last probably 5 decades really have come from all of these advances that have been made in systemic therapy. So we're not necessarily seeing big steps, but every year another 1%, another 2%, and over time, then the survival rates overall, as you see from one decade to the next, have improved dramatically. One of the areas that are being explored is either using more minimally invasive techniques for breast cancer surgery. Another very exciting area that's currently is being investigated is looking at perhaps ablative therapies. Ablative therapies means we leave the tumor in place. We use either freezing techniques or radiofrequency, laser, microwave to treat the cancer in the breast and then hopefully avoid surgery. So, hopefully down the road there are some women, if we catch the cancer early, who may be able to avoid surgery altogether.
Dr. Shen discusses what you can do to lower your risk.
There are things that can be done to reduce your risk of having breast cancer. watch your diet, avoid weight gain, and exercise regularly. Studies do show that regular exercise, up to 30 minutes, 5 days a week, can lower a woman's risk of having breast cancer by as much as 30 to 50%. It's as good as any pill that we can give you, has no side effects, has only health benefits. So I think emphasizing the importance of a healthy weight and regular exercise and a healthy lifestyle will be the most important take-home message. And get your mammogram.